Instructor, Sir Davis Don McTerroy Caviola.
I would also like to acknowledge the presence of our lovely client, Ms. Lovely Rufanel B. Maturan. Good afternoon.
Good afternoon.
Ladies and gentlemen, please stand by as we will begin in a moment.
To officially start, let us begin with a prayer, followed by the singing of the national anthem and the CDU hymn to be led by Ms. Ignacio.
So let us all put ourselves in the holy presence of God as we all say in the name of the Father, and of the Son, and of the Holy Spirit. Amen.
Lord, as we begin today, we ask freshness of your Spirit, that out of confused issues may come simplicity of plan, that out of fear may come confidence, that out of hurry may come deliberation, that out of frustration may come guidance. Let us get to our work, not head first, but heart first. May we be able to disagree without being disagreeable, to differ without being difficult, to be honest without tension, and frank without offense, in an atmosphere of team spirit. Amen.
Mga kababayan, ang pambansang awit ng Pilipinas. Kayang magiliw, pero sa sinakalan, alam ng puso, sa titik mo'y buhay. Upang hinirang, kuya ka ng magiting, sa manlulupin, di ka pasisigil, sa nagagang tutok sa simoy at sa langit ng bangaw, ay hinatang tulang awit sa pagkayang minamahal. Ang isang ng matawad mo'y tagumpay na nag-iindig, ang bituin na karaw niya kailan ang ay di magtitigil. Lumang ang araw ng walang pagsinta, buhay langit sa piling mo. Ang ligaya na pagkay mga amin, at mamatay ng dahil sa'yo. To bring more faith and long work as a team. To you we pledge our loyalty, whether school days become a memory. We pledge a mission of prosperity, and may our fame reach far and near. Oh, alma mater dear, hear our voice in our loud as with hearts afire we'll never tire to sing your praises high. We long to go water into
Ladies and gentlemen, welcome to our webinar entitled Hyperthyroidism. Here's the best way to manage it. To our client, Mrs. Maturan, clinical instructor, Sir Davis Don McElroy Gaviola. Ladies and gentlemen, good afternoon. This is me, Miss Krisha Marie A. Bangad, and together with me is no other than...
This is Mr. Gito Roland Troy.
And we will be your host for today's webinar. So good day, partner! Nanadyan ta aning last step sa atong pag-implement of health teachings, no?
Exactly, partner. And have you noticed no here sa Philippines, kay knowing our client is not in the Philippines, init na gid kaayo diri na feel na jud nato ang summer kay grabe na jud kalimot. Di ba, partner?
I couldn't agree more, partner. Murag 13 days na lang, partner, no? Before ma-end ang March, niya murag na feel na jud nako ang kainit diri sa among balay.
Exactly,
And so,
partner.
yeah, and so to start with our webinar proper, partner, would you mind introducing our group?
It would be a pleasure. Now, I'll be presenting the group members of this webinar. Starting with Miss Alonzo Devon C., Miss Krisha Marie Bangod, Mr. Birdie Nathan Neil Alni, Miss Bion Nicole, Miss Cabalas Nathalie Ann, Miss Kayude Riza, Miss Rachel Humawan, Miss Ignacio Justine, Miss Mikulov Christine, Miss Nia Villamore, and yours truly, Mr. Ginto Roland Troy.
For our objectives, we have first, define the role and importance of adequate rest and sleep in the management of hyperthyroidism.
For our second objective, identify factors that affects the sleep quality.
For our third objective, we have to enumerate ways to promote a comfortable environment for an effective sleep and rest pattern.
For our fourth objective, perform breathing exercises and techniques for sleeping.
For our fifth objective, we have to perform alternative techniques and activities that are fit for the client's condition.
And for our sixth objective, create a bedtime routine suitable for the nature of her work.
For the seventh objective, value the importance of self-care and proper rest.
Eighth objective, listen attentively to the discussion and would raise concerns and clarifications.
So before anything else, partner, ato sang kadang kamustahon ng atong gwapa nga client for this afternoon. Mrs. Maturan, how are you feeling today?
I feel great and honored. Thank you.
Now, good to hear that, Mrs. Matura. Now, partner, why don't we make this afternoon not just wonderful, but also a day full of learnings and new experiences? Di ba, partner?
Yes, Auntie. Kahibaw ka, we've anticipated long enough for this day to come since this is our first webinar sa atong NCM 114 and naa pa jud tay amazing client for this afternoon.
Exactly, Auntie. Now, to welcome us all, we have Miss Humawan for the welcome address.
So greetings everyone. So indeed it is very nice to see everyone here with their smiles and their very beautiful faces. So first and foremost, I would like to express our deepest gratitude to our client, Miss Lovely Rafanel B. Maturan, and to our ever supporting clinical instructor, Mr. Davis Don McLeroy Gaviola, for taking out a bit of their time to join today's webinar. So hyperthyroidism can be quite frustrating as there are a lot of things that affects our physical and mental aspects such as one's metabolism, energy levels, and even one's rest and sleep. So that is why when we asked Mrs. Maturan what she preferred to know more or learn more, she wanted to learn more about how to handle hyperthyroidism in terms of relaxation, sleep, and rest. So, thus, this webinar is entailed solely for Ms. Maturan's condition, and we do hope that you can get a thing or two from the information provided and that it can help you manage with your condition. So, with enough said, I will not take up much of your time. Once again, thank you very much for attending and welcome to this webinar.
Thank you for that heartfelt welcoming address, Ms. Humawan. Now, to enlighten us about the role and importance of adequate rest and sleep in the management of hyperthyroidism, may we have our first speaker for this afternoon, Ms. Alonso. Indulge us, Devon.
But before anything else, partner, before we proceed on to our first speaker, we would like to ask our client on what language do you prefer to use? Would it be Cebuano or English or Filipino?
Desire English, either both.
Okay,
Thank
thank you
you.
so much, Miss Maturan. Now let's proceed. Devon, take away the stage.
So, hello everyone. So, first and foremost, what is hyperthyroidism? So, it is a metabolic imbalance that results from overproduction of thyroid hormones, thiodothyronine, which is the T3, and thyroxine, which is the T4. Too much hormone production causes an overactive thyroid or hyperthyroidism. This can lead to anxiety, rapid heart rate, and insomnia. Sleep habits may play a role in your susceptibility to thyroid disease. One study found that people who sleep fewer than 7 hours per day are at greater risk of developing hyperthyroidism, while sleeping more than 8 hours per day may increase the risk of both overactive and underactive thyroid function. Additionally, optimal sleep is believed to support a healthy immune system, and people with weaker immune systems are at higher risk of developing thyroid dysfunction. So, getting enough sleep will help increase your productivity, energy, and physical and emotional well being. So, that is all for my part. Thank you. Let us now proceed to the objective number two.
Now, thank you so much, Miss Alonso, for giving us knowledge on the role and importance of adequate rest and sleep in the management of hyperthyroidism. Now, for our next speaker, we have Miss Bangud to share her knowledge about the factors that affects the sleep quality. Take it away, Ling.
To proceed, let us indulge ourselves to the factors that affect sleep quality. First, we have the alcohol. This may help people fall into a light sleep, but it reduces the deeper stages of sleep and leads to more disrupted sleep pattern. Alcohol has sedative effects that can induce feelings of relaxation and sleepiness. However, the consumption of alcohol, especially if in excess, has been linked to poor sleep quality and duration. So, drinking in moderation is generally considered fine, but every individual reacts differently to alcohol. Next factor, we have caffeine. This can stimulate the brain activities, which may cause insomnia, which is an inability to sleep. So we have to watch out for caffeinated drinks such as coffee and also drugs that containing caffeine, such as diet pills and decongestants. Caffeine can impact the onset of sleep and reduce sleep time, its efficiency, and its satisfaction level. So, older adults may also be more susceptible to caffeine-induced sleep troubles. For the third factor, we have medications. We have medications such as antidepressants that can cause a disrupted sleeping pattern. Also, some prescription drugs such as diuretics, which increases the need to go to the bathroom, which can wake users up during the night and thus disrupts their sleeping pattern. Fourth factor, we have smoking. So people who smoke heavily often sleep lightly and have less sleep. They may wake up after a few hours because they experience nicotine withdrawal, which is associated with difficulty initiating sleep. Sleep disturbance may be more prevalent among those who smoke more due to the stimulant effect of nicotine and its nightly withdrawal episodes. Fifth factor, we have the environmental. Fifth factor, we have the sleep disorders. Sleep disorders, such as insomnia, can cause difficulty in falling or staying asleep, which can lead to poor sleep quality and rest pattern. Sixth, we have the mental health problems or disorders, such as depressions, anxiety disorders are common in people who have insomnia, which can lead to racing thoughts at night or the inability to relax and sleep well. Seventh factor, we have the environmental temperature. A very hot or very cold temperature can disrupt one's sleep since we are less able to regulate our body temperature during a sleep. So, with this factor presented, evolving ourselves with diversional activities may promote an adequate sleep and rest pattern. So, poor sleep quality and sleep deprivation can have many negative effects. This can either be physiological and as well as psychological effects. A lack of quality sleep can even impact one's safety and safety of others. So we have to make sure that we can at least get enough and adequate sleep to promote our overall well-being. And that is all for the objective number 2. Thank you.
Now, partner, no, thank you so much for giving us those information. And again, katong mga information, di lang siya applicable lang para sa atong client, but also kitang tanan, no, kay sometimes gamay na lang gani ang times sa atong pag-rest or sa atong pag-sleep niya, madisturbo pag yun. And again, those unhealthy practices di ay maka-affect sa quality sa ato ang sleep. Di ba, Auntie?
Yes, truly, Auntie Marg. Kuan Marg, kita gid tanan no maka-experience kita nga usahay makuwangan jud tag tulog, di ba?
Exactly nga na puno-puno pa jud niya ang atong mga buluhaton nga maka hinder di ay sa ato ang pag sa quality or maka minus sa quality sa ato ang sleep, di ba, Auntie?
Yes, Auntie. So karon nahatag naman ang first part sa atong webinar. Importante gid ay na makahibaw ta sa importance of having an adequate rest and sleep and ang mga factors na maka-affect ani labaw na sa mga tao nga naay hyperthyroidism, especially parehas sa atong client.
Yes, Auntie, now kay og daghan og ubay-ubay naman jud nga mga information nga atong na-absorb, Auntie, no, to calm our minds and to prepare it pa sa mga informations no nga gipang-andam sa atong mga lovely speakers. Mag-icebreaker sa Auntie para makapahuway tang tanan, di ba? Now, Mr. Burden and Miss Bangod for the icebreaker. Take our breath away, guys.
Okay, so Mrs. Maturan, the instruction for this icebreaker is very easy. So there will be zoom parts of an object on the screen, and you have to guess the name of these objects, and also the clues will be given. So we have here an example. With distance when your alarm goes ring, 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 ring. So here is the zoom photo of the object, and you just have to guess it. Is it Mira, that ang instruction, Mrs. Maturan?
Yep.
Okay, are you ready?
Oh,
Okay, so ali na ato na sugdan na atong first icebreaker for this afternoon. Okay, first icebreaker. I snuggle in you to keep me warm. You give me enough heat in a cold morning breeze. So, Mrs. Maturan, unsa may pananaw nimo kana nga object? Unsa man na siya?
fluffy siya. Or siya blanket.
Okay, are you sure mao na imong answer?
Mm-hmm.
Okay, let's see if sakto ang imong answer. The answer is yes, that's right, blanket.
So, yes, it is a blanket. It is a soft cloth large enough to either cover or to involve most of the human's body and thick enough to keep the body warm.
Thank you for that, Mr. Verdine. Let's proceed to the second photo of this icebreaker. Roses are red, violets are blue. The light's unseen when I'm with you. So I think we're challenging ni siya gamay, Mrs. Maturan, no? So, unsa may pananaw nimo kani nga object?
Wait, stop.
Medyo listen
Sleep
siya.
mask.
Are you sure with that answer?
Yeah. Mm-hmm.
Okay, let's see if sakto ba ang sleep mask. That is correct. Sleep mask yun ang object na gizoom sa kanina photo. Mr. Berdine?
So, a sleep mask is used to cover your eyes, and this helps you sleep better.
Okay, so let's proceed to the third picture. I may be soft, I may be hard. Depends on the preferences he likes. So, Mrs. Maturan, unsa may pananaw nimo kanina object?
Vague kay siya nga clue.
Object ni siya, Mrs. Maturan?
Pero mura siya og pillow actually. So, I'm gonna go with the pillow.
Okay, so below imong answer, let's see if it's right. And that is correct. Mr. Berdine?
So pillows are used to keep the head aligned and with the neck and backbone during sleep, and this also helps you to sleep more comfortably.
Okay, so I think last na ni ang next. Oh no, if you forgot to set me, surely you'll be up by 10:30. So Mrs. Maturan, what do you think is the Zoom picture about? What do you think is it?
Ano niya akong pinaka-hate na kuan sa akong bedroom.
Kita gurutanan.
Yeah, alarm clock.
Alarm clock. Let's see if it's right.
Or clock,
And
whatever.
that is correct. It's alarm clock.
So the use of these clocks is to awaken us from their sleep in order to start their days in the morning.
Okay, so Miss Maturan, that ends our icebreaker for today. Nalingaw ra ba ka sa atong icebreaker? Mo na challenge yung pagkagamay?
Nakamata ko.
Okay.
Now, exactly no makakuan dito siya, makakurat to siya nga icebreaker kay kinahanglan jud mo mag-guess ni gizum pag gid ang part. So yeah. Well, now that's good to hear, Mrs. Maturan. Kay later on, naam na po tayo line icebreaker to calm our minds no, sa mga intervals, sa mga information, ipanghatag o i-prepare sa atong mga lovely speakers. Now, before we proceed, I would like to ask Mrs. Maturan if you want to attend to your physiologic needs, if you want to drink water or to void.
Yes. Thank you.
We'll be giving you 2 minutes now. So welcome back, Miss Maturan, now partner.
Yes, and now to proceed, partner, I hope you are all holding, sit back and relax as Miss Bion and Mr. Burdin would share their knowledge about ways to promote a comfortable environment for an effective sleep and rest pattern. Blow our minds, guys.
Hello everyone, good afternoon. I am Nicole, and together with Mr. Berdin, we will be enumerating ways to promote a comfortable environment for an effective sleep and rest pattern. So we all know sleep is important because first it improves our physical and mental health. So according to American Academy of Sleep Medicine, adults should sleep at least 7 hours a day. With that, creating a good and comfortable environment helps to promote for a better sleep and rest pattern. So these ways may include the following. First is sleep in darkness. So darkness is actually essential to sleep because when there are no lights, it sends signals to our body saying that it is time to rest. So if we are exposed to light, it affects our body's sleep clock. So when there's a light source present at the wrong time, the body's circadian rhythm, which is a biological mechanism that regulates our sleep-wake cycles, can be adversely affected. So thereby disrupting both the quantity and quality of our sleep. So what are ways to sleep in darkness? First, you can wear an eye mask, you can dim your lights, and stay away from electronics for at least 30 minutes before you fall asleep. Next is to reduce noise. You can do this by wearing earplugs or silencing your cell phones. Next is avoid watching TV, reading, or working in the sleeping area. Keeping computers, TVs, and work materials out of our room strengthens our mental association between your bed and sleep. So, meaning that if you're working from bed, it can be more difficult to fall asleep since your brain will think you're in a place of work. So, working right before going to sleep and looking at the bright screen reduces the melatonin you need to fall asleep. Lastly, keep your bedroom cool. So we know that thyroid hormone control our metabolism, heart rate, our nervous system, and also our body temperature. So it is important to have a comfortable bedroom temperature, especially while you're in the process of getting your thyroid regulated. So we should keep our room temperature for at least between 65 to 70 degrees Fahrenheit. So when you have hyperthyroidism, our glands make more thyroid hormone than what our body actually needs. So your temperature is also likely to rise. As a result, you might find yourself extra sensitive to heat and perspiring. So that is all for my part. To continue, we have Mr. Berdin.
So to continue, another way on how to promote a comfortable environment for an effective sleep is to calm down. Having a relaxing pre-sleep routine is one of the most important things you can do to help facilitate good sleep. And next is to sleep in a comfy bed. When you're comfortable, your body can relax and you can fall asleep. Being comfortable helps you stay asleep longer. Having a comfortable mattress, cool bedding, and a dark, quiet sleep environment can help you stay in longer bouts of deep sleep. Being comfortable means your body can relax. Another way is to avoid a nighttime feast. Indulging in a large meal close to bedtime can disrupt sleep. Also, if you're having trouble sleeping, it is best to avoid spicy dishes, caffeine, and chocolate before bed. Next is to have a small snack instead. Eating a little something with a combination of protein and carbohydrates, such as whole grain crackers and peanut butter before bed, can help keep blood sugars balanced overnight. And lastly, is is to de-stress. One of the biggest contributors to sleep problems is stress, and people tend to think about stressful situations instead of closing their eyes when they climb into bed. So, those were some ways to promote a comfortable environment for an effective sleep and rest pattern. Thank you so much for listening to us.
Now, thank you so much, Mr. Berdin and Miss Dion. No, Auntie, no nakabantay ka, Auntie, avoid nighttime feast and have a small snack instead. But rice is the new snack, diba? So,
Yes,
grabe kay pak. Di ba? Busog kaayo, di ba? Tuog diretso. That is why magputol-putol or in the middle of the sleep, maadto sa CR. Then, makadisturb again sa sleep quality. Di ba, auntie?
truly, Auntie. So, karon Auntie, dili na nato langayan pa. May we have Miss Caballes and Miss Cayude to show to us how to perform breathing exercises and techniques in achieving adequate sleep and rest. Ladies, please show it to us.
So, Antino, this is really the most common problem, no, if not sa kaning webinar, because there are really some technical problems that we encounter. But then again, it's about recovering, di ba? Dapat
Yes,
pretty.
Auntie, right? Dili man gid ni nato maiwasan, Auntie, no, nga maka-experience sa mga technical problems. Labi na
Yes,
nga,
auntie.
yeah, we are in these different places, Auntie. So, I guess na, Ana, nabalik na to ang presentation. Let's continue.
The 478 breathing technique, known as relaxing breath, involves breathing in 4 seconds, holding the breath in 7 seconds, and then exhaling for 8 seconds. Hey everyone, so today we'll have your primary pranayama breathing exercise. You only have to breathe in slowly while covering your ears or even your eyes as well. And you hum as you exhale. So let's begin. Inhale and hum as you exhale. Inhale. Inhale. And that's it. Thanks for watching.
So good day, Mrs. Maturan. So this is Brahmarami Pranayama breathing exercise, and this has been shown to quickly reduce breathing and heart rate. And this tends to be very calming and can prepare your body for sleep. So while practicing Brahmarami breathe, you close your eyes, block your ears, and make an audible humming sound as shown in the video.
In doing the vertical breathing, first you have to hold your breath after a relaxed exhale. Next, use your index finger and thumb to plug your nose, and then retain your breath until you feel the urge to breathe, which may include an involuntary movement of your diaphragm, and then inhale. And then next, breathe normally for at least 10 seconds, and then repeat several.
Hey everyone, so I'm gonna teach you how to do the nasal breathing. Alright, let's inhale and exhale. Inhale, exhale. One more time, inhale and exhale. Next, we'll use our thumb and ring finger to cover each nostril. So the thumb in the right nostril and inhale on the left nostril. Hold, then cover the left nostril with the ring finger, then exhale in the right nostril. Then inhale on the right nostril, hold, then exhale on the left nostril. So this should be repeated at least 3 times. And that's it. Thanks for watching.
So next is your alternate nasal breathing exercise. So this is a technique that balances both the hemisphere of your brain while simultaneously telling the chatter in your mind to chill out. And alternate nostril breathing has a natural balancing effect, and it also stimulates mindful, sleep-inducing breathing. So for the last video,
For the box breathing exercise, you only have to count for 4 counts on inhale, hold, exhale, and pause. So let's begin. Inhale. 1, 2, 3, 4. Hold. 1, 2, 3, 4. And exhale. 1, 2, 3, 4. And pause. 1, 2, 3, 4. And that's it. You may repeat this 5 to 7 times.
all right, for box breathing, this is also known as your 4 square breathing. It is a deep breathing technique that can help you slow down your breathing, and it works by distracting your mind as you count to 4, calming your body and decreasing stress in your body. And that will be all for Objective 4. Hope you enjoyed it. Thank you.
No, thank you so much, Miss Caballas and Miss Cayuda. Di ba, partner, no? Ganina, kay gihatagan na taog techniques, no? Gihatagan na taog mga tips. But karon gihatagan na po taog gishow nila, no? Gishow nila unsaon pagbuhat sa mga breathing exercises. Di ba, partner?
Of course, Auntie, what was presented is really helpful. Dili lang sa atong client, kundi nato tanan. Kay Merg, ako diri Auntie no, naminaw ko nagtanaw sa video, Merg, I feel so relaxed as well.
Exactly, Antino, most especially sa background music o sa pag-demonstrate unsaon pagbuhat sa mga breathing exercises. Di ba, Auntie?
Yes, Auntie. So, karon Auntie, before tayo proceed sa tong next objectives, may we have the second icebreaker by Ms. Villamor and yours truly, Mr. Ginto.
Okay, now, let's have our second icebreaker, no? Kay mag-ubay-ubay naman to nga informations ang ipanghatag na pod na to calm our minds and to calm our atmosphere. Now, First ato ang icebreaker, we'll be having the guest the celebrity. So we will be showing pictures of celebrities who had or who has hyperthyroidism condition or a thyroid condition. So we'll be showing you their baby pictures and you'll be guessing their names. Do you get the mechanics, Miss Maturan, Mrs. Maturan?
Yes.
Okay, now for our first pictures, we have actually provided as well choices. So for our first celebrity, we have
Um, Oprah Winfrey.
okay, Oprah Winfrey. Is that correct?
So that's correct. So I have a chica minute. So Oprah Winfrey announced that she suffered from thyroid disease. While the precise diagnosis has not been fully revealed in the media, experts suspect that Oprah suffered from Hashimoto's thyroiditis, the common cause of hyperthyroidism in the United States. However, unlike the vast majority of people with disease who experience symptoms of hyperthyroidism from the start, Oprah actually had initial symptoms of hyperthyroidism called hashimotoxicosis. Eventually, Oprah announced that she had been cured for her thyroid disease and was off by her medication. Now we will proceed to the next celebrity.
Now let's proceed. Now for our second celebrity, you have the choices of Visceral or Vice Ganda, Missy Elliott, or Nicki Minaj.
I'm gonna go with Missy Elliott kay murag obviously di siya si Vice Ganda o dili ni siya si Nicki Minaj. Pero ako kailakin sa ning Missy Elliott pero I'll have that B.
Okay, sakto ba na si Missy Elliott ni?
So correct. So I have also a chica minute. So during 2011, Missy Elliott revealed that she was diagnosed with Graves' disease at the age of 46. She told ABC News at the statement that the year she was diagnosed with the autoimmune disease that affect the thyroid back in 2008. She said, "I was on medication for a while and I managed the condition through diet and exercise." Now we will proceed to the next celebrity.
Now for our next celebrity, now we have the choices of Ann Curtis, Gabi Garciano, or Shaina Magdayaw.
Shaina.
Shaina Magdayaw. Is Shaina Magdayaw correct? Or is it John Lloyd Cruz? Check. Okay, Shaina Magdayaw.
So, Chika Minute. So, about ni siya na magdayaw. So, way back 2017, there's a fake rumor. Unsa ni na rumor. But, about the Filipina actress, Shaina Magdayo, has fallen victim to another death hoax. A number of imposter website published videos about her supposed death due to hyperthyroidism. So, in 2017, Magdayo revealed that she was hyperthyroidism after she had allergic reaction during the taping. So Instagram post in June that she felt healthy and for the first time in years, citing good life practices and help by her doctors. She said that her next goal is to rid herself of medicine from the illness. Now she is fully cured and maintained healthy by exercise and diet. Now for the last celebrity.
Now for our last celebrity, we have the choices of Taylor Swift, Megan Fox, or Sofia Vergara.
No, wala gyud ko kailan nila. Pero murag dili ni siya si Taylor Swift. Murag dili po si Megan Fox kay wala iyang black hair. Kasi si Sofia Vergara ni siya. Wow, kailangan ni Sofia.
Okay,
So,
Sofia
C.
Vergara, sakto ba? Or si Adele ni? Char. Okay. Okay, let's reveal.
So correct, Sofia Vergara. So nanadyo ko yung last nga chika minute. So kanisha, she was 28 when our routine doctor's checkup found something unexpected. She felt a lump in my neck, she recalls. So the next few weeks were whirlwind to the test but that confirmed her doctor's suspicion. So Vergara had thyroid cancer. So it was very traumatic. She says, I was young, I had a young son, but I tried not to panic. I decided to take charge and inform myself. Of course, I couldn't Google thyroid cancer from my comfort of my house back then, so I went to the bookstores and found out everything I could about it. She learned that she'd have to undergo surgery to remove the thyroid gland, and now she managed her lifestyle with good sleeping pattern and healthy eating habits. So that's it for the icebreaker. I hope you enjoy our Chika Minute.
Back to you, Ling.
Now, nalingaw ko ato nga murag ko anda na siya chika minute ba. Now, so hapit na mahuman nato ang webinar. Ato sang kamustahon ng atong lovely client. Unsa may iyang masulti so far sa mga information na share sa akong mga ka-group niya. So, Miss Maturan, kamusta man ka?
Na-impress ko kay kuan take jud sila into researching different kinds of ways and how to kuan promote rest and sleep, especially nga we need it nurses labi na karon sa pandemic, and it is a really great thing for me. And thank you so much guys for kuan for having me as your guest.
Indeed,
Okay.
Antino, even though knowledgeable na kaayo field with knowledge nato
Ay
ang
dili.
client kay nurse ni siya, di ba? But indeed, a little reminder na lang guro ni para sa atong client, no, nga to, to take good care of herself, because at the end of the day, it is about, about yourself, food, because you cannot give care, you cannot impart care and love and passion to other people if you do not take good care of yourself. Di ba, Auntie?
Right, Auntie. So, Mrs. Maturan, would you want to have a break, sa? Would you like to attend to your physiologic needs? Or we
I'm
can...
good.
Okay, sige. To continue, may we have Miss Ignacio, Miss Humawan, and Miss Mikulob to deliver the alternative techniques and activities for sleep. Girls, the floor is all yours.
All right, so hello everyone. So the first alternative technique that we have is taking in melatonin. So what is melatonin? So it is a hormone that your brain produces in response to darkness. So it helps your body know when it is the time to sleep and also to wake up. So why do we take it, or why do people take it? So people use melatonin when they have occasional insomnia or they have trouble falling asleep and staying asleep. So they also take it for some other sleep problems. So when is melatonin used? So melatonin supplements are used to adjust the body's sleep-wake cycle and are said to help with insomnia, jet lag, sleeping disorders due to shift work, or delayed sleep phase syndrome. So insomnia, the optimal time to take melatonin supplements is between half an hour and 2 hours prior to the desired bedtime. So for jet lag, we have the best results seem to occur when melatonin supplements are started on the day of travel and taken at the desired bedtime at the destination. So for shift work, so since night shift work disrupts the circadian rhythm, it also connects with insomnia, which is why it is also used by people who work at night. So as for delayed sleep phase syndrome, so delayed sleep phase syndrome is when normally your bedtime is, let's say, at 12, but then if you have delayed sleep phase syndrome, you would usually sleep at maybe 1 a.m. or 2 a.m. So daily intake for up to 4 weeks may improve sleep, and it also reduces the amount of time that is needed to fall asleep. All right, so the common side effects in taking melatonin is headache, dizziness, nausea, or drowsiness. So, since melatonin can cause daytime drowsiness, you should not drive or use any machinery within the 5 hours of taking the supplement to prevent any accidents from occurring.
Yes, so that is it about melatonin. So same with everything, no, too much of everything may not be good. So just maybe keep watch lang on your melatonin intake. So just make sure Miss Maturan to discuss with your doctor as well on how much you can take this melatonin. So moving on, we have the use of essential oils. So again, Miss Maturan, I am Miss Humawan. So, essential oils or the use of essential oils is also known as melatonin. So, this can help you reduce stress. So, if you want to take melatonin supplements, essential oils can also
Now, since the internet connection of Miss Humawan is not that stable, um, informing you if she'll be back because she'll be taking over now.
hello.
Okay, now, Rachel, take
I'm so
on.
sorry. I'm so sorry. Where was I? I last na here. I think so. Okay, I'll talk about again, if you do not want to use over the counter meds, an essential oil is just one type of all natural sleep inducer. So, in general, essential oils can have many different benefits, such as weakening certain diseases. For example, the eucalyptus has been found to have antiviral properties. Also, it strengthens the immune system, like how the thyme and peppermint has anti-infective properties. So it also soothes feelings of anxiety. Essential oils are a powerful way to help you relax and sleep better. For example, lavender essential oil is widely recognized as a natural sleeping aid. So I would just like to ask Miss Maturan, have you ever used essential oils before?
Yes, I use it a lot here. Especially katong nag-COVID kay COVID nurse ko diri. So, need gid kay nako yung mga like citrus essential oils, eucalyptus, lavender, and it really helped me a lot. So far, salamat sa Ginoo, wala gyud ko nagka-COVID, but I made sure that I'm fully vaccinated. I get extra shots from COVID.
Okay.
So,
Yes, so it's really useful. So even medical professionals, nurses, doctors, they even stand by using essential oils. So again, researchers, this is because it is backed up by research. So researchers found that lavender, for example, increased the amount of slow and deep wave sleep in participants. So all participants in that said study reported feeling a higher vigor the next morning. So how do you apply these oils? You can apply it directly in the soles of your feet, on your palms at the beginning and also at the end of the day to help you feel calm and relaxed. Or also, another very popular way is using a diffuser. So you just add water into a diffuser and have a few drops or maybe essential oils ready and just leave it in your bedroom. So that will have its very relaxing effect. So that's it for aromatherapy. I will now give the floor to Miss Mikolov for imagery and meditation.
So thank you, Ms. Humawan. Hi, Ms. Maturan. I'm Ms. Nikolov, and now let's talk about imagery or visualization. So it is another common type of relaxation training. It is where you visualize peaceful, pleasant scenes or imagine yourself breathing quietly. So gently falling asleep and having a good night's sleep. So ikaw, Ms. Maturan, like naka-try na sa ka, like mag-imagine lang while say kung padung ka
um,
matug. Unsay mga
yeah,
usual.
a lot. Most of the time, but most of the time kung mag-imagine kung murag mag-overthink ko, so mo siguro niya akong last resort. or an
Okay.
imagery, but it could help like ease anxiety most
Yeah, like
especially.
nasa dyan yung mga benefits. So here are the benefits of imagery. So it helps the mind and body relax. Next is it manage anxiety, stress, and depression. And lastly is it helps reduce pain. So like if mag-imagine naman ng ganita, like mga positive lang siguro mas matura, no? Pero dili lang ta mag-overthink. And then next is the meditation. So it likely promotes sleep by reducing pain sensitivity and stress, both of which can disturb sleep. Maintaining a regular daytime mindfulness meditation practice will help you sleep better and stay asleep longer at night. So mag-meditate ka, Mrs. Maturan?
Yes, yeah, important din yung meditation.
That's good. So here are the benefits of meditation. So it promotes sleep by reducing pain sensitivity and stress. Next is it reduces negative emotion. And lastly, it activates parts of the brain that control sleep. And that would be all for the objective number 5. Thank you.
To continue, may we have Mr. Ginto and Miss Villamor to create a bedtime routine with the client. The mic is all yours, guys.
Now, once again, good afternoon, Mrs. Matura. Now, before anything else, this schedule or this daily plan is just a sample, no? So you can just revise or change it on your preferred schedule. Most especially that there is usual change of time or schedule in your work. But as what you've mentioned during our interview, your duty is at night. So we have created a sleeping routine for you to be able to adjust as well on your schedule. Now, from 7 a.m. to 7:30 a.m., going home and eat breakfast. From 7:35 a.m. to 8:05 a.m., taking a warm bath. From 8:05 to 8:10 a.m., prepare your bedroom with calm music or anything that you prefer. Or if you have like a favorite book, you can put that beside or at the bedside table. Now from 8:10 to 8:12, leave the electronics alone. Most especially know that we get distracted. And again, as we sleep, do not put your electronics kanang duol ninyo kay. Most especially if nali mo ring or mo kanang mga notifications that are not important, ma-disturb dayon ta. And again, makuha na pud ang ato ang sleeping hours or atong rest time. Now from 8:12 a.m. to 3 p.m., have an incredible 8 hours of sleep. Next slide.
So to continue, so taking a warm bath. So as part of your sleep-wake cycle, your body experiences various hormonal changes throughout the day. One of these is melatonin production, which begins in the evening to prepare you for sleep. At the same time, your core body temperature drops. Scientists have found that a warm bath can trigger a sleepy reaction. Also, since your work environment is prone with many microorganisms, it's better to cleanse your body right away. And I believe that prevention is better than cure. After taking bath, we will proceed in preparing the bedroom. Next slide, please. So preparing your bedtime, so dedicate part of your bedtime routine to transform your bedroom into a sleep oasis. Make a ritual out of making things as cool, dark, and quiet as possible. After being comfy in bed, now we will proceed to listening to music. So next slide, please. So people listen to music to help them sleep. So the genre isn't important as long as the music relax you. Close your eyes, listen to the music, and let it distract you from your worries and calm you down. And if you have a dog at home, you can cuddle them because I believe dog is a stress reliever. Next. So leave the electronics alone. So electronic devices, including computers, televisions, especially smartphones and tablets, all emit strong blue light. When you use these devices, that blue light floods your brain, triggering into the thinking it's daytime. So as a result, your brain suppresses increases melatonin production and works to stay awake. So that's for it for the objective 6. Now we will proceed.
Now let's proceed onto the open forum. Now, Miss Maturan, do you have any questions and clarifications?
Um, yeah, I do have questions, but you want me to ask now or later? But with the presentation itself, it was really well presented, so I don't have questions with it.
So thank you so much, Miss Maturan. But if you have, yeah, as what you've said, that you have questions, you can raise your questions now.
Oh, okay. So considering that I am a patient with endocrine disorder, why is it important for patients with endocrine disorder to know how to manage their symptoms? Mara na siya.
Now, Ms. Naturan, the best advice we can give you is to make sure to attend to all your appointments with your physician, with your obstetrician specifically. Your obstetrician is the best professional to share your concerns regarding the pregnancy. While having a condition, if possible, your OB and endocrinologist should be able to discuss your condition and monitor it no, because as what you've said earlier on to our interview that you are pregnant as well. Now it is important for patients as well with endocrine disorder to know how to manage their symptoms such as fatigue, weakness, unintended weight fluctuations in order to minimize the escalation of the prognosis. Now preventing it rather in worsening the condition, such as we have the thyroid storm, which is considered as an emergency and life-threatening condition. And again, we should,
Thank you.
as what our reporters earlier said, it's about the lifestyle and the practices as well that really affects the condition.
Okay, thank you.
Do you
So
have any other questions, Miss Maturan? You want to?
Um, there is another question. So, when investigating a patient with autoimmune endocrine disorder, should the physician look for other autoimmune diseases as well, like diabetes or systemic lupus erythematosus or whatever endocrine disorders that could happen to a person? Um, like duha sila ka buo in one person. Can it happen? And how can we manage it? And how can we educate our patient with it?
So to answer your question, Miss Maturan, so my answer is yes. There's a good chance that the patient will have symptoms for another autoimmune disorder, which could be caught at an early stage and treated. So further patient with other autoimmune disorder have an increased probability of autoimmune thyroid disease compared with the general public and may benefit from testing.
Okay, thank you. One last. This is related to me. Like a patient, like a nurse working 12 hours per shift and working night shift too. What advice is best to maintain quality of life? It's just like considering my work schedule, my occupation, how much stress it gives me. What can you advise?
Okay, Miss Maturan, our advice for individuals like you working night shifts is to stick to a routine to maintain your quality life as much as possible. Also, to always make sure to compensate your lost hours of sleep by sleeping during the morning or whenever you are having your spare time. Also, we have to, as what my group mates have discussed, we have to make sure that your bedroom is conducive for sleeping by using blinds or the sleep mask if needed. We also have to maintain a healthy diet, try to exercise regularly, and also stay hydrated. So basically, it's all about the mindset and your determination to stay as healthy as possible as you can.
Thank you so much.
Do you have other questions, Miss Maturan, or is it
I think maura na siya. So far it was very informative.
okay? Sige. So, Auntie, that was so engaging, no? Knowing nga naadjoy tayo na share nga knowledge and information sa atong client from our webinar na atong gi-conduct karon kay as a student nurse, fulfilling good kay siya sa part, di ba, Auntie?
Exactly, Antino niya, coming from our client na good that the webinar was so informative. So at least, no, ibalo na tanga nurse yan, nakabalo na siya yung mga factors. Then again, reminder na lang niya siya, a gentle reminder na lang of taking good care of herself.
And
Yes.
also a reminder to you too that in the future when you get into nursing, when you pursue nursing, it's not gonna be everyone who doesn't have any knowledge about all of this condition. They can be doctors, they can be pharmacists, they can be nurses. So don't get intimidated. Just be certain in a way na what you want for them is for healing, with good intentions.
Exactly, Miss Matura, no? As long as we know and we do our job, no, and our profession, yeah. We do it with passion and love, no? So now that finally ends our webinar. Now for the presentation of e-certificates, as we are very grateful for the participation and the presence of Mrs. Maturan, we have Miss Villamore to present the e-certificate.
So good day. This certificate is proudly presented to you, Mrs. Lovely Rafanel Maturan, for actively participating during the webinar entitled Hyperthyroidism. Here's the best way to manage it by BSA 3B Group 2 conducted today, March 8 and 2022. Signed and acknowledged by our group leader, Riza Kayuday, Level 3 Chairman Ms. Angela G. Perez, our ever supporting clinical coordinator, Ms. Phoebe Kates Mangreen, and Mr. Davis Don McLeroy Gaviola, and the Dean of College Nursing, Mr. Romel P. Marioles. So it will be directly sent to you, Ms. Maturan, via Gmail.
It will be sent to you, Miss Maturan, via Gmail.
Thank you.
To formally end our webinar, may we have Ms. Mukulob to deliver us the words of encouragement.
So thank you, Ms. Bangad, to our clinical facilitator, Sir Gaviola, to our dear client, Mrs. Maturan, and to my fellow group mates, good day. So I hope all of you had a great time. We have reached a point where we need to end our health teaching. But before that, I would like to start by thanking you all, first off, for the speakers for their excellent thought-provoking talks. Congrats to all of us guys who have been working together to make this webinar a successful one. And to the host of this webinar for keeping things both under control and reasonably on time. And to Sir Gabiola, our clinical instructor, whose assistance and advice have indeed been important and for contributing to the webinar success. Most importantly, I'd like to say thank you to our dear client, Mrs. Maturan, for being here today and taking the time to patiently listen to what we had to say, despite on her busy schedule. We hope, Mrs. Maturan, that you learned something from us. And I won't hold you guys for too long. I wish you all a blessed day, and it's been a pleasure being with you all of today. Have a great day, everyone. Once again, thank you for attending today's webinar entitled Hyperthyroidism. Here's the best way to manage it.
Now, thank you so much for that, Ms. Mekulov. Now, Mrs. Maturan, an acknowledgement slip will be sent to you together with the e-certificate. So, ang kaning acknowledgement slip, Ms. Maturan, this will serve as an evaluation for the performance of the reporters and the speakers for this webinar. If you have suggestions and concerns, or if there are things that we need to improve. Now, before we end this virtual meeting, can we request everyone to open their cameras for documentation? Smile wildest, ladies and gentlemen. So 1, 2, 3, smile. Another pose. 1, 2, 3, smile. Okay, thank you so much.
This officially ends our webinar.
Thank you.
Thank you and continue to be safe.
Now, primum homo esto, let him first be a man. These are the student nurses from BSN 3D from Cebu Doctors University Group 2, now signing off. Thank you, everyone.
Thank you.
Good afternoon, sir.
Okay, good afternoon. Can you hear me clearly? Hello?
Choppy, sir.
Hey, gamay, sir.
Kana, hello?
Hello? Yes, sir. Madungog ka, sir. Pero naay murag static, sir.
Ano say static? Sorry na ako sa kaning
Okay, sir.
sa
Okay
mewang
lang, sir.
internet. Can you hear me
Ay.
clearly?